Hi, Miss Smith. My name is Cheryl, and I'll be your nurse for today. How are you feeling?
Not good.
I notice you're struggling for breath, so let me just, one of the things I'm going to do quickly is just to elevate your bed higher, so that way you can, we're able to have you breathe a little bit better. Are you feeling any pain? Just shortness of breath, can't breathe properly. I also noticed that your oxygen is not on. The doctor did prescribe oxygen for you. I'm going to put it up to 2 liters. Let's put on your nasal prong.
Thank you.
You're welcome. Just put up to 2 liters here and hope that will make a difference for you. Just going to do a quick check for your vital sign to see how you're doing. So let me just check your respiration right here. I'll check your pulse. Okay, well I see that it's 25 breaths per minute, which is a bit higher than normal. I'm just gonna do your blood pressure for you.
Can we increase the oxygen?
You want us to increase the oxygen?
Yeah.
Okay, I can go up another liter for you.
Can't it go more than that?
Not too high, and the reason for that, I can always speak with the doctor about it, but the reason why we don't want to have too much of an oxygen increase is because of your condition. Right now, because you have COPD, the oxygen actually, your body depends on CO2 as a signal for breathing, and the oxygen will suppress that signal, and we don't want that to happen. But of course, we'll speak with the doctor and see what we can have done, okay?
Okay.
So let's get your blood pressure reading here. Do you know what your normal baseline is?
No.
No. Okay, so I'm showing that your O2 stat is at 85 and your blood pressure is 155/70. So let's just take this off. Sorry. Your pulse is at 104, which is a little bit high. So we're hoping that will come down with the change in position and the oxygen being on. Okay, so one of the other things I wanted to talk with you about is just to sort of help you to do some exercising that will sort of open up your lung field and strengthen your breathing ability until the doctor sees you. So this is an incentive perimeter.
I don't want it.
You don't want this one. Have you used it before?
I tried it yesterday. It's not user-friendly. It's too much work.
Okay, that's fine. We have other alternatives. So another thing that I found that helped my client to breathe, to better able to breathe and to use less accessory muscle is the pursed lip breathing. So I'm just going to ask you just to follow my direction. I want you to inhale through your lip, purse your lips, inhale, and then slowly breathe out. The goal is to make sure that your inhalation is less than your expiration. So your expiration should be longer, okay? And slowly do that. In and out. So it slows down your breathing, pace yourself, and you're using less energy, okay? How do you feel? Feel a little bit better? Okay, great. So that's good.
Yeah, we have this.
And I did notice in your chart that you have been smoking for 30 years, Ms. Smith. That's a long time.
What does smoking got to do with this?
Smoking actually is the #1 risk factor for COPD. Yes. Have you ever tried quitting before?
I tried every time I try. I just smoke some more.
Because what we find is that smoking cessation is one of the #1 treatment that helps our patient to manage their lung function. And since you've tried, it seems that you are open to trying quitting. So what I'm going to recommend, have you used any nicotine patch or any sort of spray or anything like that to aid you in your craving for the cigarette?
No.
Okay, so I'm going to recommend that. That's something that we look into for you, okay? Okay, great. I see that the pursed breathing is helping you out a lot. So let me just quickly just listen to your lung sound to see what's happening there. Can you just speak up a little bit here for me? Listen to your lung on the back. Great. I can hear some wheezing, and that's consistent with your condition, okay? So I'm going to speak with the doctor. Now, one of the things that we usually recommend for a COPD patient, for newly diagnosed patient, we usually recommend the bronchodilator. We start with the short acting first, and if that doesn't work, then we go to the long acting bronchodilator. We have the Spiriva, and then we have the Advair, and those are medication that will help to open up your lung field and get you breathing a bit better, okay? So those are some of the things that I'll be speaking to the doctor about when I meet with him, okay? How are you feeling now? You seem to be doing a little bit better. Great. Is there anything else you'd like me to help you with? Okay, great. So I'm going to leave you for a little bit, right? So I'll put your bell here for you. So if you need anything, you just ring, and I'll be right there with you, okay? So I'll see you later, okay, Miss Smith?
Thank you.
Take care.